Any man who has tried and failed pill therapy, injection therapy, shockwave therapy, and vacuum erection device is an excellent candidate for penile implant. However, one does not have to fail all therapies to be a candidate. The penile implant is generally covered by most insurance plans and Medicare. Call your insurance and ask if the CPT code 54405 is a covered service under your plan. If it is, then the procedure is covered, and your insurance deductible will depend on which plan you have, and what that rate is will vary from plan to plan. There are two types of penile prosthesis available in the United States: the malleable 2-piece penile implant and the inflatable 3-piece penile implant. The malleable penile implant is composed of two metal coils that are put inside the erectile bodies. This creates a permanent erection that's either bent up or down depending on the desired use. The inflatable penile implant has two cylinders that sit inside the penis that fill with saline and can be emptied and change the erectile status. Patients can look completely flaccid if they want, or inflate the device. The 3-piece penile implant's got three working parts to it: the two cylinders sitting in the shaft of the penis, a pump in the scrotum, which is completely hidden and nobody knows it's there, and a hidden reservoir next to the bladder. The 3-piece penile implant has got a pump in the scrotum, two cylinders that sit inside the erectile bodies, and a hidden reservoir next to the bladder. When you wish to use the device, simply grab the pump, which is found between the testicles at the bottom of the scrotum, and begin pumping. This will create a fluid transfer between the reservoir and the chambers inside the penis. In general, you want to pump up between 20 to 30 times to create an erection. Once this is fully erect, then you can use the penile implant. The penile implant will stay erect until you hit the deflate button, which is found just above the pump itself. Here's the deflate button, and you can see once I've pressed it, I can then squeeze the shaft and transfer the fluids from the cylinders back to the reservoir. After you have successfully deflated the penile implant and you're happy with the fluid in this chamber, you can lock the device by hitting the pump button once. The penile implant will not change orgasm, ejaculation, or sensation. It just makes you as hard as you want, for as long as you want, with whoever you want. The inflatable penile implant is completely concealed inside the body. Nobody will know that you have it, especially when it's deflated. One would have to feel the scrotum to feel the pump inside the scrotum itself. The malleable penile prosthesis is a little bit harder to conceal because it's erect all the time, although one can bend it downwards to try to conceal it some more. The Coloplast Titan penile prosthesis is made of BioFlex. This BioFlex technology allows us, the surgeons, to customize the antibiotics, antifungals, and the anesthetics that we put on the implant itself. The BioFlex technology is very rigid and will allow over 1,000 psi worth of pressure traveling through those cylinders. This translates to a harder erection than when you were 18 years old. This is also a great scaffold for if you have penile curve, and I have done studies demonstrating that the Titan penile implant is a favorable device, especially in men with penile curve or corporal fibrosis. The solution inside the penile prosthesis is made of normal saline. This is harmless to the patient if there happens to be a leak. The penile prosthesis is inserted through one of three approaches: subcoronal through the foreskin, penoscrotal through the scrotum at the base of the penis, or infrapubic at the top side of the penis just behind the pubic bone. The penile implant is inserted with two cylinders into the erectile bodies with a pump inside the scrotum and a hidden reservoir with the fluid transfer between the two different chambers, operated by the pump in the scrotum. The recovery depends from patient to patient. In general, post-op recovery after penile prosthesis is 4 to 6 weeks. Certain patients, like diabetic patients and those on chronic steroids, may take up to 8 weeks. Generally, patients in my practice use the penile prosthesis approximately 5 weeks. However, certain patients, like those who are diabetic or on chronic steroids, may need to wait up to 8 weeks for the incision to fully heal. Penile prosthesis usually lasts approximately 10 years. There is no studies showing that increased use will make it last any shorter. It's just wear and tear inside the body as time goes on. My overall patient satisfaction rate is 96% for a penile prosthesis. I warn patients of 3 main risks for inflatable penile prosthesis. Number 1, you cannot go back to pills, injections, or shots or other therapies, and you will always need a penile prosthesis in order to have intercourse or sexual activity in the future. Number 2, the device itself will only last you 10 years. You may need another surgery. The third item is penile shrinkage, or loss of penile length. This is not a hard and fast rule and can be mitigated with vacuuming before surgery. Other potential risks for penile prosthesis surgery include bleeding, infection, scar, erosion, mechanical malfunction, inability to inflate-deflate device, or herniation of reservoir.